There is a powerful therapy for cardiovascular disease that will save your life. It's called EECP, or Enhanced External Counterpulsation. And this video is also going to tell you about a remarkable, inspirational, and healing woman by the name of Sara Solati and Global Cardio Care.
It's kind of like a natural bypass.
The results are great.
It literally saved my life.
Located in the heart of Los Angeles, Global Cardio Care Center is the nation's largest and most active EECP clinic. This center delivers more than 20,000 hours of treatment on an annual basis.
Global Cardio Care exists because the #1 cause of death in the United States is heart disease. The #2 cause of death in the United States is cancer, and #3 is stroke. When you take #1 and #3, we are dying due to blockages in our arteries. Well, the important thing about the work that we do at Global Cardio Care is to give information. Information is power. So many people come to our clinic and don't even know that they have the disease or they have the symptoms of the disease. Well, we can make a difference. We can give them information, we screen them, we educate them, we empower them to let them know that they can make a difference in their own life and be a part of their health care.
I had a stroke in 1998. And once you have the stroke, gosh, you can't do hardly anything that you can do, so I all of a sudden realized that I had lost everything.
Oh, I had a lot of severe pain in the chest and some difficulty in breathing. And so I would try anything, especially I was interested in alternative, because for me to go into a surgery type thing didn't attract me. And so I felt this was the answer. And I found it to be so.
I had angioplasty. I had 2 clogged arteries. The arteries happened to be where it was actually blocked, was at a junction where the 2 came together. And they put the stents in, but because it was on an angle, the stents laid down rather than standing up. So 2 weeks later, they had to go back in and either try to take those out or put in 2 additional stents. That didn't work either, and so they scheduled me for bypass surgery.
I'm Dr. Franklin Murphy, board certified in internal medicine and cardiology, clinical professor of medicine at UCLA. We have a variety of ways to treat coronary artery disease. We can give patients medications, we can do angioplasty, we can do bypass surgery, and now we have EECP. EECP, however, stimulates the growth of new blood vessels to go around the blockages and or the widening of these new vessels, which are already naturally beginning to occur as part of the normal mechanisms of the human body.
My name is Dr. Ronald Weaver. I'm an internal medicine specialist. Enhanced external counterpulsation. It is a remarkable treatment that is non-invasive with no side effects, that is very effective in the treatment of patients with cardiovascular disorders.
My name is Cranford Scott. I'm an internist in private practice. I'm also a clinical professor of medicine at USC School of Medicine. I had one patient who actually came here who had had a stroke, and she had not been able to talk, walk, or eat. She was actually on G-tube feedings, and she was not able to walk at all. And after 1 week of treatment, this patient now was able to eat, talk, and she threw away a walking cane, and she's now a testament to this therapy.
EECP is FDA approved. You simply lie on a comfortable bed. 3 blood pressure cuffs are placed around your calves, thighs, and buttocks. When your heart is at rest, the cuffs pump oxygenated blood from legs up to the heart. This opens new arteries and it improves total cardiovascular function. Call Global Cardio Care. Schedule a free EECP session today And after you have the experience, tell your family and friends about the power of EECP. I did.
One of the greatest things about Global Cardio Care is to be a part of the patient's improvements. And patients come in here like Buddy Colette, and he had a history of a stroke, 8 years being in a wheelchair, and after 35 treatments, he's walking, he's able to play the saxophone, he's back to feeling like he has a life, and he doesn't really need to give up, and he can continuously improve his health. We see that all the time at Global Cardio Care.
I was in a wheelchair for 8 years after I had the stroke. I could not walk, and I wasn't thinking about eating because I wasn't hungry. Just my life had kind of passed right by me. But then I heard about Global Cardio, which I've been through the program where the 35 days of every day coming for treatment, and it gave me a boost, because I was in a wheelchair after that. And once I began to come here, I felt I had new life. People here were so wonderful. It was almost like coming to a family setting. Everybody knows your name, and they all talk to you and say hello. You need inspiration from somewhere, and I sure got it here. So I want to say that I want to thank all the help and Sarah and everyone that encouraged me to kind of get up from that chair and see what you can do.
When I first heard about EECP, I was really quite skeptical. The therapy seemed kind of bizarre with heavy-duty blood pressure cuffs, squeezing legs, thighs, and so on. But after I finally understood what was really occurring, I really became aware of the fact that this therapy was something that could provide a alternative means of treatment of heart disease. You see, by this squeezing action, delivering massive amounts of blood flow to the coronary arteries and the heart, the patients actually develop new blood vessels to go around the blockages. It's kind of like a natural bypass. It's bypass without using the surgery. It's angioplasty without having to go in and dilate the arteries. It's a much less invasive, kinder form of treatment that we have. It just so happens that EECP provides us yet another tool to treat people who do have coronary artery disease.
By using the CardioLite machine, we're actually able to see if the patient's heart has improved. Don Murphy had come here, he had 2 blocked arteries. When we put him on the CardioLite machine, we actually saw a large area of his heart that was not getting enough blood. That's why he needed bypass surgery or EECP. By doing 1 hour a day, 5 days a week for 35 treatments, we then did another CardioLite to see how his heart had improved from before EECP to after EECP. After we took that CardioLite, we saw that not only did it open up new arteries, but we actually saw his heart muscle improved. From the beginning of his EECP treatments till the end of his EECP treatments, his heart had turned out to be 100% improved, with getting blood up to the heart muscle, and lots of collaterals, which are new arteries, were all over his heart.
I was experiencing extreme chest pain. I went to the hospital. They immediately took me into the operation room and put in 2 stents. A week, 2 weeks later, I was experiencing even more chest pain. Took me back to the hospital, and they wanted to take those stents out but couldn't get them out, and they had to put in 2 other ones. Those stents didn't really work either. 2 weeks after that, they wanted to do, bypass surgery. And my minister, Reverend Michael Beckwith, was telling me about Global Cardio Care, and he insisted that I come and meet Sarah and her staff. And we started the procedure of the treatment here at Global Cardio Care.
It is 100% safe, it's FDA approved, there's no medication, there's no surgery. You simply lay down on a very comfortable bed. There are 3 blood pressure cuffs that are wrapped around your calves, your thighs, and your buttocks. At this time, we have you timed to the heartbeat with an EKG. So during the time when your heart is at rest, these blood pressure cuffs start to squeeze the blood from your lower extremities and pump it throughout the whole entire body. For the first time, your heart gets to rest, but internally you're getting this massive passive cardiovascular workout, and for the first time your blood pressure, your heart rate drops without you having to do anything but simply lay down and take a rest.
To this date, I haven't had the bypass surgery. I've continued my treatment here at Global Cardio Care. I'm feeling great. I don't experience the pain in my chest or the numbness in my arm. I'm back exercising, walking mountains, and feeling 100% better. They literally saved my life.
Call Global Cardio Care. Schedule a free EECP session today. And after you have the experience, tell your family and friends about the power of EECP. I did.
EECP does a number of dramatic things to the human body. We've seen it be very effective in treating diabetes, Parkinson's, high blood pressure, stroke, and again, just a whole constellation of various illnesses.
In my patients who have gone through Global Cardio Care EECP treatments, they've had various medical problems. Not all have had strokes or cardiovascular conditions, but I've had patients who had diabetes, which we also know is a risk factor for coronary heart disease as well as peripheral vascular disease. They have reduced therapy needs for insulin or oral agents if they are taking that for the control of their diabetes mellitus. It's my understanding that that occurs as a result of the increased blood supply that you see, also the weight loss that you see in these individuals who complete the course of EECP.
There are risk factors that we can change, such as high blood pressure, high cholesterol, diabetes, obesity, and stress. These are things that we can improve for a better health. Every single year, Albert comes in and gets 35 hours of EECP. Why? Because it's preventative. Albert has never had bypass surgery. He's not on blood pressure medication. He's not on blood thinner medication. He's not on heart medicine. He's not a diabetic. He exercises every single day, and he's never had to have any surgery.
I had a lot of severe pain in the chest and some difficulty in breathing. And so I would try anything, especially I was interested in alternative, because for me to go into a surgery type thing didn't attract me. And so I felt this was the answer, and I found it to be so. They increase the blood flow to the entire body. It's great not only for people that have heart conditions or preventive heart conditions, it's great for any type of condition that I can think of, because it makes sense. The flow of blood is the key to good life, and that's it.
100% of the people feel better once they get the treatment. And we find that with this improved feeling better, they seem to be able to exercise more, to enjoy life more.
I now play tennis, I play paddle tennis, I go to exercise classes, no lack of breath. I can breathe. People are amazed. They look at me and they say, wait a minute, you got the energy of a 16-year-old, and I do.
My name is Don Murphy. I'm 57 years old.
So my name is Buddy Collette. I'm 84 years old.
My name's Al Weber. I'm 91 years young, not old.
EECP for the last 11 years has been successful in treating people with cardiovascular disease. Unfortunately, the industry uses EECP as last resort. They choose to have people do bypass surgery first, angioplasty second, when all surgical invasive procedures have been utilized and there is nothing else that a physician can use. EECP is being used as last resort.
I have a real good feeling for the director and founder of this clinic, Sarah Salati. She's a dedicated individual who puts a whole heart into this thing. This is not profit motivated. This is motivated by love. And she expresses it with all her people here. It's a very comfortable place to come to. It's wonderful. You feel comfortable. The treatments are wonderful. The results are great.
Call Global Cardio Care. Schedule a free EECP session today. And after you have the experience, tell your family and friends about the power of EECP. I did.